Good evening. In our news bulletin for this evening, the Secretariat of the Pacific Community is assisting Niue to develop a draft Niue Family Bill. The public health medical health checks involve Niue primary school students in the World Health Organization serious survey on hepatitis B. Senior management within the Niue Public Service built their capacity this week in a training workshop for policy implementation and evaluation. Bank trials an extended period of opening hours this month based on customer feedback. Niue is in the process of drafting a family law bill that will include the various aspects of family law and protection of family rights. In September of 2014, the Niue government sought the support and technical expertise and assistance of the Secretariat of the Pacific Community for a legislative drafter to complete the drafting of the family law bill. A team from the Secretariat of the Pacific Community Regional Rights Resource Team are on island as part of a fact-finding mission to gather information and discuss with various stakeholders.
We've been talking to the courts, to the police, to government people, and also people who have been formed, I think, a domestic violence group in terms of their feedback. So the whole process was just discussions around what should go into the family law bill of Niue. So that includes marriage, what does marriage mean in Niue, and should the marriage have problems, what the problems are. So that includes divorce, maintenance, residence, access for children, and also domestic violence. So in Niue, if those issues arise, what's the best way that the law can respond? The law is a response to what issues that any society would have, looking at the particular disadvantaged groups, making sure that their lives, in a way, they have access to better lives. So family law looks at the family. The family is a core unit, is a fundamental unit of society. And if we talk about family law, it's really recognizing that there are problems within the core unit, and government or states around the world in the Pacific, they have moved towards saying it's our responsibility. We see that sometimes families have some problems, and we make the commitment to address those problems through laws.
The SPC RRT team are working together with the Ministry of Social Services to ensure that the necessary provisions are included within this bill. This process is a revival of attempts to develop laws in the past to protect families' rights. Discussions this week have indicated that there is a will and a desire to further develop the family law bill.
From our perspective, we feel that people, from the discussion that we've had, this is long overdue, so the people that we've consulted with are basically saying, yes, we want this, but we want it crafted in such a way that it is a response to Niue's needs. Not looking at any other country, but looking at what we need, what our situation is. In terms of what Niue is doing, we work on this kind of law to address family issues around the Pacific. So in terms of what we've seen so far, it's promising that Niue is going to have a law that is futuristic. So not just looking at the problems in families that we have now in the communities, but also perceived problems that would come in the future. So that's very encouraging.
Ruby says that the way forward for the team, they will return to SPC and collate information that will be either in the form of a commentary or draft bill. From there, dependent on government's agreement, the team will return for another round of consultations based on that document. The hope is that a draft will be presented to government that will be eventually tabled in the Niue Assembly at some point. The Public Health Division has continued with health checks within the schools, and this year they have surveyed students in the Niue Primary School for hepatitis B, data collected for the World Health Organization serious survey.
In 2007, there were discussions in the Pacific around the importance of actually carrying out the survey. So this was confirmed in 2013 and had been rolled out last year. So out of the 210 students that are there in the primary school, we managed to cover and to do the test for For only 17 students actually didn't take part in the test because 11 students were overseas and 6 students did not get consent from the parents. Now, hepatitis B at the early age, you don't get to see the symptoms, hence the reason why there's a real concern for us to do the survey, because the symptoms would show up later on in the later years at 40 to 60 years of life, and by then it would be usually too late for any intervention to be done. So thus far, from the results that we have had, none of our kids came out positive for hepatitis B, meaning that they are fully immunized, so they don't need to get an extra booster dose to cover them. At birth, they have 4 vaccinations from hepatitis B, so one at birth, one at 6 weeks, another one at 3 months, and another one at 5 months. So if we had a positive case that would show that we either had given the vaccination, there was a delay in the administration of the vaccination, or there was a problem with the transportation of the vaccines from where it was manufactured and provided up to, it's the cold chain, the transport of vaccination from point of supplier to us. But thus far we've been really fortunate that none of our kids came out positive. And I think we also need to thank Mrs. Minipulu, who is the former Principal Public Health Officer who had supported and initiated the program. So we are in the process of trying to complete all of those, but at the moment we need all of the parents of the students in the primary school to please submit their baby books so that we can confirm the actual dates in which the vaccinations had been given.
Health officials say that it is important to identify whether there are any people who have hepatitis B, because if untreated, this could cause liver failure or liver cancer. According to Public Health Officer Griselda Mokoia, children are normally immunized from birth, and they would like to identify whether the vaccines have worked and detect whether there are any who may have hepatitis B. Hepatitis B affects the liver that can cause both acute and chronic infections, and the virus is transmitted by exposure to infectious blood or bodily fluids. However, infection is preventable by vaccination. Although the focus of the survey is on the children, it is also important for people to understand how hepatitis B is transmitted to prevent any new infections.
Hepatitis B can be, in the case of the children, it can be transmission from mom to the child when the mother had given birth to the child at birth. So there's a high possibility that if the mom was a carrier for hepatitis B, she might be able to pass it on to the child. So those who are already carriers of hepatitis B, they can pass it on to the others if they cut themselves and they share their razors or toothbrushes, or they don't cover their wounds properly. They could also get it through sexual intercourse. So those are some of the ways that you can pass on hepatitis B if you are a carrier to someone else who hasn't gotten it.
Public Health are appealing to parents to provide information from their children's baby books so that data can be compiled into a report. This data will be presented to the World Health Organization to confirm that NEWS status or verified as hepatitis B free, or there is zero prevalence. Public policy implementation and evaluation was on the agenda for senior managers and heads of departments who have been in a 2-day training workshop this week. This capacity building initiative, funded through the Australian aid, is part of ongoing work of the Pacific Island Centre for Public Administration and their mandate to strengthen public administration to enable improved service delivery to people and foster economic growth. Niue is one of a number of islands in the Pacific to benefit from this training that will help senior managers in their roles. We spoke to the main facilitator to find out more about this training.
Most of the senior public officials are involved in terms of making decisions on policy implementations and policy evaluation. So it's important for them to know what to do when implementing policies as well as evaluating policies. It adds value to their decision making in respect to these things. Our center, which is called the Pacific Island Center of Public Administration, and we are under the umbrella of the University of South Pacific, and we are funded by the Australian government. The idea is to have this kind of trainings continuously for quite some time, so that we have created a pool of public officials in each country on this thing. So when they move up or migrate, at least there's somebody else there in the ministry who can be able to do these kinds of things.
This session is a continuation of a workshop that was held in 2013 that was based on policy analysis. New Public Service Commission Chairperson Georgina Tukiuha says it is important for senior managers to know exactly what policies they work according to, as well as strengthening the public service. Although these sessions targeted mainly senior level management, it is hoped that they will be able to share this knowledge with staff within their respective departments.
It's a great feedback. I think most have a good understanding now of where to begin once they have a cabinet directive to implement a particular decision of government. So they know exactly what steps that they need to take, right, once they receive that from cabinet. And of course, evaluation, which comes at a later stage of the policy cycle. We are going through that today, and hopefully by the end of today they should be able to know exactly what to do after the workshop. Some of the key outcomes is for senior managers here to know exactly what their role is when implementing and evaluating policies. And then we discuss some tools or some models that will guide them through in terms of doing implementation as well as evaluation.
The training workshop concluded today, and Dr. Amosa will depart the island tomorrow to hold similar workshops in Samoa and Fiji. As of Monday this week, Kiwibank has started the trial extended hours for the bank's services. Kiwibank started operations in Niue in April of 2013 through the Niue Commercial Enterprises Limited, and at the end of last year there was a merger with the Niue Development Bank. Initially, when taking over from the Bank of South Pacific, the bank has continued with opening hours from 8 in the morning until 3 in the afternoon. General Manager for Kiwibank, Matt McPherson, said that the bank had conducted a survey earlier this year to gauge customer satisfaction with services provided by Niue Development Bank and Kiwibank. From that survey, the feedback showed at least 40% of customers wanted extended opening hours. The new opening hours on trial will mean that the bank will open from 8:30 in the morning until 4 in the afternoon, and this will go on for approximately a month. Within that month, the General Manager says they will try and accommodate the needs of the Kiwibank staff as well as the public. That concludes our news bulletin for this evening. Do join us again for our next news bulletin next week, and do check out the Makefu Whalekahua Tour Show Day this coming Saturday. We'd also like to wish all the mothers on the island happy Mother's Day this weekend, not forgetting all those who will be involved in the White Sunday programs.